Melanie Lamb, formerly known as Mel Helmick. I used to be Arkansas's dog whisperer. My story began in 2009 when I began having problems with my vision. And I went in to see a neurologist, and he wanted to perform a brain scan and a lumbar puncture. And we did that and wanted to make sure I didn't have MS, and we cleared me of that, but found a small pineal cyst in the brain, which is typically normal, okay, I guess, and it's very small, but found that what I did have going on was some intracranial hypertension, or known as pseudotumor cerebri. After the lumbar puncture, I had to have a blood patch. After treating me for almost a year with Diamox, he felt he needed to send me to another neurologist that specialized more in the head. Sent me there. This doctor disagreed that I didn't have pseudotumor cerebri because I didn't weigh 300 pounds, and sent me in for another lumbar puncture. I discussed with him, could we not do an x-ray of my neck, because I'd had a car wreck with whiplash years prior and I had had problems with that, but he disagreed and said no, I have to do the lumbar puncture. So he sent me in for the lumbar puncture, and the whole day was a mess. I was 3 hours behind getting seen, so the doctor that was scheduled to perform my procedure was already gone, so they had to find another doctor to do it, and apparently I was a kink in his schedule. He rushed me in, and thankfully I had a friend to go with me for this procedure. I wanted to leave. I was scared, and I guess because the whole day had been messed up, I was on Diamox, which dehydrates you severely. They didn't want me having water or food for, 24 hours before, or from the night before midnight and on. And so I was very thirsty and dehydrated and frustrated. The doctor came in and started prepping me, and I'd not had a Valium or a sedative as I had before, and I was very nervous. And he made it seem like a big deal that I'd asked for that, and said that that was not normal procedure, that this was done all the time, it's no big deal. He began the procedure and had the needle in my lumbar attached to what they call a manometer to read the pressure on your brain. And he didn't have any assistance with him. A nurse came through, and he asked her to hand him an instrument off of the table, and she said, "Doctor, I don't think you want me to do that." And he said, "Why the hell not?" Just like that. And she said, "Because I've not scrubbed yet." So he sent her out of the room. He reached for the instrument on the table, and it was out of reach, and he got off balance. And when he did, he jammed the needle all the way through my quadrant equina, through the part of the horsetail of the spinal cord. And it went all the way through. And the pain was horrific. All I could do was hold on to my friend's hands, and I was trying to scream, and nothing would come out of my mouth, but the tears flooded my face because the pain was torturous. And it shot all the way up to my shoulder blades, and it was like it shot out, and it had like cockaburros digging in me, and shot all the way down to my feet. And it felt like I was there on that table for an eternity. He got done, he walked out, he never said a word, not I'm sorry or anything. They put me in the recovery part and treated me there. They had to call my neurologist and get me sedated. Sent me home. Went in for another blood patch because I was ripped apart. Of course, I wasn't sent in for, my neurologist didn't send me in for like 3 to 4 weeks later for an MRI to see what damage had been done. I later found out that was probably because of all the blood that would have been shown in the MRI. He was covering his rear, I suppose. And then he dropped me as a patient. But before he did that, he did end up sending me in for an MRI. He had upped me to 3,800 milligrams of Neurontin along with muscle relaxers. It gave me no relief. The pain, it's beyond imagination. Sorry. After that, I was sent to a neurologist who performed a myelogram. After that, I had to have another blood patch. After the MRIs, I was diagnosed from the second neurologist. I was diagnosed with arachnoiditis with empty sac sign, meaning that if you were to open up the lower part of my spine, you wouldn't see the nerves hanging down because they were already encased in scar tissue. I spent several months in the bed. I couldn't go to the bathroom without help because I couldn't walk to it. I couldn't work. I left my job, and I miss my job. I miss my life. And then I was sitting for the myelogram and had to have a blood patch after that. I've since then been diagnosed with RSD because of the arachnoiditis. My bladder, I've lost control of that. I have problems using the bathroom. My feet, my legs, I'm losing them. The pain is horrific. It's like a jellyfish is like in my spine, and it reaches around and it just electrifies me. And it's funny because I just got out of the hospital a few weeks ago, and a doctor explained to my family that he had a friend who had this, and that he described it as a jellyfish being stung by a jellyfish wrapping around the rib cage from the spine. If you could imagine that, and then times that by 100. Of course, everybody's face was like, wow. And then he says, but wait, now times that by 1,000. That's her level of pain. And it goes from her back all the way to her feet. I go through times where my feet peel excessively till they bleed. I turn all kinds of colors. I've spent most of my life outdoors working with my handlers and the dogs. And now I'm ashamed to even show my body. I ended up getting a pain specialist, and he ended up sticking me again. It had a sympathetic nerve block, bilateral twice, and I had 24 hours of not sweating. People with arachnoiditis and RSD, we sweat a lot, and when we sleep, we wake up. You have to wash your sheets. You can take your shirt off and actually wring the sweat out, and it happens during the day at any time. I can. It's all but destroyed my life. I don't even remember the last time I drove. I miss my children. I miss my family. Sometimes, people hug me, and it hurts. If I go outside, the air hits me, and it burns. Seems like I'm always on fire, and I get an outer burn where it hurts to touch my skin. So I wear soft clothes. And then there's the inner burn, and the inner burn is awful. It feels like your organs are literally melting inside of you, and there's nothing you can do to stop it. My pain scares me. It terrifies me because I don't know when my flare-ups happen if that's going to be the last one. And sometimes I just pray to God that it is. But yet I want to live. I don't want to miss out. I have a grandchild. I have the best boys ever that have grown up training dogs with me and search and rescue, explosives, narcotics, and we can't do that anymore because I can't get out there. I'm losing my abilities. This is very difficult. And I'm doing this, I'm sharing this because I don't want anybody else to have to go through. Nobody deserves this torture. And it is torture, it's pain. I can't express how painful it is. My pain escalates to where my blood pressure will shoot up to stroke zone. They kept me in the hospital this last time for 2 weeks. They had me on all kinds of drips. I have a port. They couldn't take me off the medicine because my pain was so high. I would have died. I would have had cardiac arrest. Like, my body couldn't have handled it. I don't know. I don't know how to live with this. It's a day-by-day thing. I can tell you, there's a lot of dark moments. Because, especially when you're alone, because you don't know if you're going to survive through it that night or not, and all you want is to have all of your friends and loved ones around you, because I would miss them, but I get so tired and exhausted from fighting the pain all the time. Even on all the meds that I take, I still wake up every 2 hours in pain. and I'm on some pretty heavy medication, and I hate medication and what it's done to me. I'm very educated, and I get very forgetful, and that's frustrating for me. I can't teach and instruct because I tried, but I couldn't do it. I've sheltered my family and most of my friends from being around me because I don't want to see them feel helpless like my doctors. I've had my doctors look at me and cry. I had one doctor, I love him dearly, and he cried and he said, "I wish you would have walked in here and told me you had cancer because I could have cured you. I can't fix you, but I promise I'll do everything I can for you to help get you back in the field working." There's a lot of times that, and you have dark moments. I've had the thoughts of, yes, you would call them suicidal thoughts, but I would never do that because one, I would want to be pretty. When I died, I could never shoot myself or OD or anything and leave that with my family and my friends. But I get so tired with the pain that I have to fight really hard at times because it gets so high. I could just lay there and let it go, and I know that I would pass. I cling to God as much as I can, and I have a lot of questions, a lot of whys. I remember walking out of the hospital that day, being wheeled out of the hospital, and remembering an old lady that was sitting in the waiting room and a little girl. They weren't there together. And I remember coming out of that hospital and thinking, my God, if what happened to me prevented them from having to endure what I just endured, then I'll carry that burden, I'll carry the pain, because that elderly lady wouldn't have made it through it. And that little girl wouldn't. She wouldn't deserve to live a life like this. It's every day. I get no relief. You would think with all the meds I take that I would, but I hit a 10 every day. I think that I know something needs to be done about this. There's too many. It's an epidemic. There's way too many people that are being injured by this. It's risky. I wish I could go back and change time. I miss me, and I miss my life, and I don't want. It kills me because I don't want my children to watch their mother wilt away. I'm only 42. I had a wonderful career. Clients from all over the country. And I miss them. And some of them, they still travel and come and see me. They stay in touch with me all the time. I now use a walker and a wheelchair. I can't be on my feet long at all. I was never warned. I was never told that this could happen. They tell you these procedures are done every day. And I've been talked to about the spinal cord stimulators too, and they're done every day. It's okay. Well, my response to that is lumbar punctures are supposed to be okay, and they're done every day too. They're perfectly safe. I'm crippled for life. There is no up from here. The goals that I've set for myself since this happened have failed. I used to run a lot and track, run Pinnacle Mountain easy, and I'll never be able to do those things again. I'll never be able to enjoy that with my children, but thankfully they do it for me about every week, and they take pictures, and that makes me happy. And they've been so good to me. Since then, I've got married, which is why my last name is Lamp now, and he's the best husband ever, and why he would have chosen to marry me knowing what lies ahead for us is beyond me. But I know he's helping me to survive. And my friends, I have wonderful friends and family, and I would be lost without them. But there's gotta be something done, because it's a silent epidemic. Doctors run from it. They don't want anything to do with it. And thankfully for me, I was diagnosed early on when it happened, and I've not had doctors deny or run from me, really. Other than that one neurologist, most of my doctors look at me helpless like the rest of my family. There's nothing they can do. And, my one doctor had told me if I could have just come in there with cancer, he could have healed me. But there's nothing he can do. He explained to me that it's progressive. He didn't think that because of all the times they had been into my back, that I would stabilize and stay right where I was. And I didn't. I keep progressing. Constantly have white blood cells in my urine. I can go weeks, up to 2 weeks, without using the bathroom. It makes me look like I'm pregnant. I was tiny, and I was pretty, and I enjoyed my life. I'm not sure where to go from here. The pain is so severe, you just want to lay down and just let God take you. But you fight. And you fight because you love your family and you love your children. Yet you wonder, is it better to roll over and give in to it so that they don't have to watch the suffering? Or do you clinging to God, that He will just lay His hands on you and heal you? I apologize for all the tears. I'm sure it's hard to understand me, but I'm trying here. I try to keep my chin up. I spend most of my time indoors. And I used to be so active. I was hardly ever inside the house. I was always out working and doing what I did. Um, I, I don't know what to say other than if anybody wants to go into your spine, please seek an alternative. Talk to somebody else. See if there's another option. Um, all the meds that they put you on, it messes with your head. You have memory loss, more dizziness, more off balance, and you still have pain. I was told by a doctor that I would actually OD on medicine before my pain ever stopped completely. That's how severe it is. My sleep patterns, I wake up about every 2 hours in pain. And that's taking medicines that's supposed to make you sleep and not have pain. I spent this past week, 2 days, all I ate was oranges. I was severely depressed and here alone. And I clocked it and I'd cried for 24 hours. And I ended up in the shower. I dropped to the floor in my shower. And I stayed there crying to God to please heal me. Or please show me what it is. Where is the blessing in this? How am I supposed to help people? Where do I go from here? To please shelter my children from all of this pain and my family. Because I miss them so much. And I stayed there till the hot water ran out. That was yesterday. I'm terrified. I have PTSD from the procedure that went bad. I wake up screaming, crying, trying to rip the needle out of my back that's not even there. I open my eyes and all I can see is that doctor. And it's the same dream every time. My biggest fear, what terrifies me most is my next flare-up. This last one was pretty critical. Very critical. I don't want to die. I don't want to die yet. It's not my time. I know I have much more to give. Through all of this, I've somehow managed to write a book about dogs. Standing with the dog, not saying that for an advertisement, hey, go buy my book. I'm saying it because I want other people who suffer this to find something to grab a hold of. Work with training your brain through your flare-ups to be able to focus on other things. Biofeedback. Counseling is very important. You gotta have somebody to talk to. I don't really know what else I can say. But I do miss my life, and I miss my children, and I miss the work that we used to do together, because we were an awesome team, and everybody in this country knew it. And I've missed out on a lot of training opportunities and deployment opportunities since then. I'm blessed to be able to share my story. And I want my story out there because I don't want anybody to ever have to suffer the pain that I have to suffer. Nobody deserves this. Nobody. And you can't let it make you bitter, because it did me too for a while. And the bitterness, it will eat you up. And you've got to find something that can make you smile, that can stop your tears for a little while. The joy of seeing my husband and my kids give me that. And my friends and my family. I want to thank you for putting this out there. And again, I want to ask of you, I also had the sympathetic nerve block done too. This was just 4 months ago, bilateral. So there's more needles stuck in my spine. It's horrible. It's just horrible. So please, if you're considering having it done, pray hard about it. Seek another opinion. And for those of you who have arachnoiditis and those who may have the RSD like I do because of it, and the gastritis and the neuropathy and atrophy and everything else that comes with it, you don't fight alone, because I'm here fighting with you. And you don't burn alone, because I'm here burning with you too. I'll close with that. God bless.